this decision to have another booster shot for COVID-19. Can you take me through why that decision was made?
So yesterday, CDC recommended a new updated COVID-19 vaccine for everyone over the age of 6 months. I think we all wish we could leave COVID in the rearview mirror, but it's still here. And unfortunately, it's still causing harm. And what we know from these vaccines is that they protect you from the most serious harms that this virus can cause: hospitalization and death. I particularly want to focus this on folks who are over 65, who are the majority of the folks who are getting hospitalized or dying from COVID. They should be making a plan right now to get their updated COVID vaccine. But this is really recommended for everyone. And so we want folks to know it's safe, it's effective, and it'll give you the most protection you can get going into this fall and winter season.
How quickly are those booster shots going to be made available? I see that they're starting to ship out now, but when will they be in pharmacies and accessible for anyone who wants them?
Sure. Well, we're outside of the emergency period of time now. So these vaccines will be available similar to how you get your flu shot. So we made that recommendation yesterday. We expect them to start to get ordered and shipped in the next couple of days. So we think by the weekend, you're going to see these vaccines be available in pharmacies like CVS and Walgreens and in your doctor's office by next week.
When the news of this came out, so much of the response that I saw was immediately people unwilling to make the decision to have another booster shot or to even have a shot at all if they had one in the first place. And I'm seeing, as you mentioned before, some people who it might be as simple as they don't want to, talk about COVID. They don't want to admit it still exists. But there's other people who are taken by things like conspiracy theories and still refusing to exist or admit COVID exists at all. So I guess, how do you convince them to continue to make health decisions for the good of others?
Well, I want them first, obviously, hear from me directly, but I want folks to know that I'm not just the CDC director. I'm also a mom and a wife, and I wouldn't recommend something for the American people I wouldn't recommend for my own family. I have a 9 and 11-year-old daughter. They're going to be vaccinated. My husband's going to get vaccinated. I'm getting vaccinated. And of course, my parents who are over 65 getting vaccinated. So again, I want folks to know that, we wouldn't make those recommendations without a lot of clinical data and evidence. This vaccine has been given 600 million times here in the United States. It's been incredibly evaluated. So it is safe, it is effective. And I want folks to get answers to their questions. So go to vaccine.gov where you can get more answers to your questions and also find locations where you can get a vaccine.
I'm seeing a lot more cases popping up lately. Is that just because people are behind on their booster shots, or are we going through a strain right now that's particularly aggressive?
Yeah, so it's a combination of the fact that our protection and immunity does decrease over time. So even if you've had COVID before or that you've been vaccinated before, unfortunately, our protection does decrease over time. And you're right, this virus is changing. So there are new changes to the virus, but this updated COVID vaccine that is recommended for everyone 6 months and older is matched to the current changes in the virus. So again, it gives you that protection going into fall and winter. And we know fall and winter time, at least based on the last 2 years, is when we see more virus circulating again. So great time to get yourself protected.
Probably the third or fourth booster shot, I think, for some people now. Do you anticipate this being more like a flu shot that you get every year that you kind of have to update?
We're still a little early in this, and COVID's not exactly like flu. For example, you were just noting we are seeing uptick in cases in the summer timeframes. And so I think we still have more to know, but likely this is going to be with us, and it is likely going to be something more like the flu shot that we'll see every year. But what we know is right now we have an updated COVID-19 vaccine that is safe and effective, and we want to make sure everyone has it, not just to prevent things like hospitalizations and death, which we absolutely want to prevent, but we know it also decreases your risk of long COVID. We know, unfortunately, that folks who just get COVID, even sometimes mild COVID, can have long-lasting symptoms. Getting vaccinated and getting treatment can also reduce your risk of getting long COVID. And for me, that's something that's really important. I don't want to see anyone getting long-term symptoms from this. We have to make sure we're using all the tools that we can to protect ourselves. Vaccine is certainly one of them, and that's the best way to, again, get us into fighting shape for this fall and winter. But make sure you're also thinking about getting tested if you get sick. So you can find out, do I have flu? Do I have COVID? Because getting access to treatment could also save your life. So making sure that you're getting tested so you can get treatment. And then it's all the common sense solutions that we need to layer on to protect ourselves. Washing your hands, staying home when you're sick, ventilation, wearing a mask to protect yourself. All those things we can choose to layer on top of each other to make sure we're the most protected. Think about who you are, what your risks might be individually, but also who are you around? Are you going to visit, someone who might be fighting cancer and undergoing cancer treatment, or someone who is older going to visit the grandparents next weekend? Think about not only what your risks are, but who are you around as well.
Thank you so much for your time, doctor. Hope you have a great day.
All right, thanks so much.